All right, I am going to go ahead and get us started. It's 5 after. My name is Sarah Tracy. I am the VP of National Workforce and Education for TPMA. Thank you all so much for being with us today. Again, apologize for the technical difficulties we are having with Eventbrite. This is going to be recorded, so anybody who didn't get the link in time to join us will be able to watch afterwards. So I think, Stephen, if you could pull the slide deck back up, I will do my official intro. So welcome. Today we are here for closing the skill and equity gaps through sector partnerships. You all saw this description, but I'll just refresh your memories. As business and industry continue to address talent shortages and equity issues, sector partnerships have become the go-to strategy for preparing a diverse pool of job seekers with skills and technical knowledge they need to thrive and meet local employer demand. So we're really excited to hear some best practices from folks who are implementing sector partnerships and working on these talent strategies, bringing job seekers into different industries. So really excited to be with you here today. Couple of housekeeping items. We encourage you to chat amongst yourselves and also to use the Q&A function at the bottom of your Zoom screen to ask questions of the panelists. I will jump into those questions towards the end of the hour. Another thing I mentioned, we are recording. This webinar will be available on our YouTube. I'm sure Stephen will be posting a link on our LinkedIn as well. So please do share it out if you found it helpful. And lastly, please be on the lookout for an email from us after the webinar with a link to a survey. We want to know how we did. Please be kind on the technical difficulties, but we'll be on our way up from here. So a little bit about myself. My name, as I said, is Sarah Tracy. I have been with TPMA for about 6 weeks now, but I am a boomerang. I also worked for the organization for about 6 years previously. And in the interim, I was with the Ohio Manufacturers Association for just over 3 years, where I led our industry sector partnership strategy. So I have been deep in the trenches of sector partnerships for most of my career in workforce development, and I'm really excited to talk with you all today. I wanted to start off with a little bit of a definition, and I'm going to give a shout out to my former employer, the Ohio Manufacturers Association, by sharing a tool that we used to define sector partnerships. So that's in the chat if you want to check it out. But really the way I think of sector partnerships is they are an industry-led public-private partnership that's focused on workforce development, usually focused on a single industry, although there are some sector partnerships that will have 2 or 3 industries with different subgroups to focus on. And the goal of those sector partnerships, the reason that they're beneficial, is they're designed to increase alignment between industry needs and the public workforce system or workforce partners. They increase buy-in among employers and partners on talent strategies and help folks to just paddle in one direction. And so we are really excited to get into things. I'm going to ask each of our panelists to introduce themselves. So as we go around, ladies, if you could say a few words about who you are, the organization that you work for, and what its role is within your sector partnership. And I'm going to start with Alexandra, please.
Hi, everyone. I'm Alexandra O'Connor. I'm from Canton, Ohio, and I work for the Canton Regional Chamber of Commerce. But our Chamber of Commerce is contracted by the Stark County Manufacturing Workforce Development Partnership, which is obviously a manufacturing ISP in our county, which is Stark. We're about an hour south of Cleveland. So our partnership serves any manufacturers and all locally that want to participate. And the chamber helps manage like different programs and grants through our partnership. And then I work very closely with Frida, who will introduce herself, but through our partnership activities.
Thanks, Alexandra. And I will go to Frida next.
Hello, my name is Frida Robinson, and I am the Workforce Development Manager for the National Center for Urban Solutions. We were contracted by the Canton Regional Chamber of Commerce, along with the Stark County Manufacturing Workforce Development Partnership, to actually assist them in our grassroots recruitment and for the Good Jobs Challenge. So like Alexandra says, I'm located here in Canton as well. We work very closely. And I think we get the job done.
Great. And I look forward to hearing more about how you get the job done in just a few minutes. I'm going to go to Hope next.
Hi, thank you so much for inviting me to be here today with you. I'm the Executive Director for Workforce Innovation at the Health Collaborative, which is in Greater Cincinnati, the tri-state region. And I've been convening our healthcare industry sector partnership now since 2016. However, I do want to call out that our ISP actually started in 2003 when the regional health systems came together and decided it was time to stop swapping their staff for small raises and instead working together to build the needed workforce. And they had tremendous successes, but it's their spirit of cooperation that is just as imperative today as it was back then. And it's great to be able to say that we are all still very invested in our mission of increasing the size, diversity, and preparedness of our region's healthcare talent pipeline. We have a focus on entry to mid-level careers. I'll throw in too that prior to this role, I was the Director of Workforce Development for Sinclair Community College for almost 10 years and did work in custom workforce solutions with key employers. Developed training to hire programs in call center and finance, and also provided open enrollment courses and even served as an employer liaison for a Gates grant, completion by design initiative, aligning students' education needs with employer needs, which is all work that has helped me hugely in my current role. Again, thank you.
Yeah, thank you for being here. And Hope, I did not know that you had a history with community colleges.
Yeah.
We have a lot of folks from community colleges in the audience today, so I'm glad that you'll be able to share that perspective as well. And last but not least, Helena.
Hi, everyone. My name is Helena McKinney, and I work with Hope at the Health Collaborative in Greater Cincinnati. I am a senior manager of workforce initiatives, and in that role, I do a number of things, including run and organize our TAP Health program, which is a program for building the next generation of healthcare professionals. So we work with high school students as well as middle school students now and college students to get them interested in healthcare careers and all sorts of careers. So medicine, nursing, everything, the entire gamut that's out there. So that's what I do. And then since I've been in the role, we have grown the program tremendously. I've been working with the program for over 8 years now. And we started off with 13 students in our first small group a year. And now we have nearly 100 in our group that runs every summer, as well as we see about 1,000 students throughout the year through other programming as well. So we'll be happy to talk about that throughout today. So thank you for having me.
Great, absolutely. Thanks for being here. So I want to jump back to another thing that Hope said, which is back in 2003, one of the earliest sector partnerships in Ohio, at least, you mentioned employers kind of poaching those employees back and forth. And I think as I've worked with sector partnerships in manufacturing and in other industries in Ohio and in other states, that is almost always the impetus. It's like, we can't keep hiring the same people and giving them a 50-cent raise here, a dollar raise here, and just passing them back and forth. We've got to create a bigger talent pipeline, right? That seems to be the impetus for so many sector partnerships coming together. So what I want to do is spend a little bit of time with Alexandra and then with Hope talking about the two industries that we have represented here. So specifically, Alexandra and Hope, I'd love to hear what are some of the biggest challenges that the manufacturers and the healthcare employers are facing? How are they coming together to solve those problems? What's going on in your industry right now?
Can lead if that works. So we're with manufacturers, and the Stark County Manufacturing Workforce Development Partnership is far newer than Hope's healthcare partnership. We founded in 2021. And it was like a collection of, at first, a small collection of manufacturing leaders at local manufacturing plants that knew each other and were kind of contacting each other for advice on combating like their workforce struggles. So this same root cause, trading employees, and developing basically each other's programs that they were like using to poach, and just kind of like improving them each step of the way and then poaching back. And so these manufacturing leaders felt like they were just undoing each other's work when if they coordinated and kind of collaborated in their efforts and then actually shared successful methods of attracting new employees, that they could expand possibly the pool of new employees in local manufacturing opportunities, especially because locally we have a rather high rate of poverty and a high concentration of like the urban population that is relying on some sort of subsidies. And so the like manufacturing leaders locally kind of felt like, how can we help stimulate the local economy by actually like uplifting wages, by kind of collecting together and recognizing what is necessary. And then how can we also develop programs that are accessible and prevent like the fall off because of benefit cliffs and or like fears of like life adjustments when you go from like one set of circumstances to working in a manufacturer, which is something you may never have done. And then of course there was the existing struggle of combating preconceived notions of manufacturing and sharing available careers and pathways in employment in the sector. So it was like a little bit of marketing, but also a lot of like employment preparation programs, but then also just like reevaluating existing systems in our industry locally to find best practices and then try to institute them across the board so that it levels the playing field, like manufacturer to manufacturer a little bit, but it also opens up similar opportunities in varying manufacturing plants and organizations for potential new employees. So that was the base of it for us.
So when I think about our industry sector partnership, part of the challenge we face, and Sarah and I've talked about this, is the way our state thinks about healthcare. They think about us as a population-driven sector, not a GDP producing sector. And we've been doing more research into this, and in our region, our economic impact is about $33 billion, which includes direct employment of nearly 140,000 jobs. It's our number one employment sector and one of the fastest growing sectors in the region. And of those jobs, 116,000 of them are in clinical roles, which have a lot of regulations surrounding the credentialing, the licensure, and such. And it's this workforce, that 116,000 clinical roles, that's projected to grow yet another 1.5% in just the next 2 years. All that while currently we're sitting with 16,000 vacant positions. And again, this is in the greater Cincinnati region. That's bigger than some cities. Our biggest workforce challenge is by far the need to create the clinical healthcare workforce. And each year the Health Collaborative performs 2 workforce surveys of our member health systems and some of the regional hospitals. And in that, we include 60 different clinical roles. Currently, 21 of the 60 have vacancy rates exceeding 10%. And another 8 of these jobs have vacancy rates between 7 and 10%. A normal vacancy rate in a typical labor environment, which we're in anything but a typical labor environment right now, but a normal labor vacancy rate for us would be about 5%. So we start seeing this many roles at 10% or higher. You know that we're all feeling the critical shortages, whether you're a patient going to an emergency room, a doc, a nurse, somebody at registration, everybody's feeling it. And I'll say prior to COVID, in any given year, we might have seen 3 to 5 jobs that were having vacancy rate at 10% or greater, not 21. So this makes it very hard to even prioritize where to start. Although we've been doing a lot of work in the nursing pipeline of late. But as an industry sector partnership, again, we're working to increase the size, diversity, and preparedness of the talent pipeline. And we very much work through our regional employer education, workforce, and community partners to do this. We focus on building skilled workforce that meet the employer's needs, providing educators the resources they need to attract and propel students into healthcare career. And a lot of what Helena does is that career exploration side. We work to increase students' access to the work-based learning opportunities as well, and then to connect job seekers into local healthcare careers. So sort of thinking about like how we start with the education pathways, I'll say we're deeply committed to working with our regional and our statewide education partners to increase student access to and success in earning the in-demand healthcare credentials and degrees. We convene a healthcare education and workforce leaders group, both regionally and statewide, to help identify needs and barriers and to go after solutions. We've had some phenomenal success over the last 2 years digging into the nursing pipeline. One example is with practical nursing, LPNs. We were able to get LPN to be recognized as Ohio's first ever ITAG. ITAG being an industry credential transfer assurance guide, meaning that credit is granted based on having the license. It's a practice pretty common with other certifications, but it has not been used in healthcare. So this was a pretty big win. And it also helped to open up then the pathway for any active LPN in Ohio to go to a state school and be guaranteed credit and help them to get in then to the LPN to RN bridge programs which already existed. So it really helps to create a more open pathway into nursing, which is our most in-demand position right now in the state. I have other examples, but I don't want to go on and on too much. But suffice to say, we've been providing funding to our career technical centers to expand their nursing programs, get more LPN availability to high school students. We even worked with our Ohio Department of Health and opened up rules for the CNA, the Certified Nurse Aide role in Ohio. It's STNA, so that we could deliver the didactic part of the learning in a virtual environment, which is so much better understood than ever before. And now we're helping another career tech center to do that and really pilot a hybrid model on this to open it up to their comprehensive high schools. So there's just so many different ways that we're working with our different partners. But the other big part, and I just don't want to miss saying this, for healthcare and probably for many of the sectors, is the cost of agency staffing, contingent agency staffing. And we've recently been able to uncover a great best practice happening in upstate New York that we've already brought back to that with some of our key employer partners, and are going to actually be doing an information session later this week, to talk about whether or not this is another solution we can bring in, because we'd like to help to see them have savings there as well and be able to gain better control of their finances.
Excellent. You hit on so many great points, both of you, Alexandra and Hope, and there's we need like a full day to dig into all of this, right? But so a couple things that I want to kind of put a pin in for if we have time, or if people in the audience have questions. I'd love to come back around to how you engage the employers, what the, you know, something that I come across a lot in initial conversations about sector partnerships is, why should they? Right? Why should businesses take the time to get involved in organizations like this? So if we can talk about that a little bit later, we should. The other is, I think sometimes we see when sector partnership gets into a new region, a new community, sometimes there's a little bit of concern from the other workforce and education partners in the area that the sector partnership is going to be competition, but really it's about funneling more people into the programs that already exist and working together. So if we can come back and talk about that more, I'd love to do that also. But I want to come back to some of the pre-planned questions that we have, and what we really focus the promotion around today's webinar on, which is equity. So if we could all of you, and maybe we can start with Frida and Helena, since we haven't heard from you for a few minutes, but a lot of sector partnerships are putting equity at the center of their work. And so I'd be interested in how these two partnerships that we're talking to today are doing that.
I can start if you want, Frida. Just to talk about equity in career exploration, and how that's worked with our businesses in the region. We found that making sure that our businesses know and our students know that they are valued, and that we need people that look like the community that we serve, is the most important part in healthcare. So it's been it was challenging in the past to kind of explain, like, why do we need to work so hard to find physicians and doctors and even phlebotomists and staff right at the door that when you walk in that look like us. But we have been able to show throughout all this research of how patients have better outcomes when they see more people, even in the waiting room, even behind the desk, that look like them, and especially clinicians. And so it helps hospitals to have better outcomes and to have patients who are thriving and coming back less, because they are taking advice more when they're there at the hospital, because they have staff that they can connect to. And so that's why it is a priority in healthcare. And that's just across the board. I think it's probably a priority in all the industries, but I just wanted to touch on how we're a little bit unique in that. And also, one of the things we try to do, Hope explained how our region is unique. We're a whole tri-state. We have so many different types of hospitals and so many different types of counties that fall under Greater Cincinnati. So it's more than just looking at ethnic diversity. We're also looking at gender diversity to make sure that we can get more men represented in nursing. We're looking at getting more people from rural counties represented in all the hospitals and all the different practice settings, making sure that we get different things that will that it can be included in all of the work that we do. And so even at the high school level, we are trying to talk to students and show them, like, this is why you belong in healthcare. And so it's really important to us to grow our program. So when I mentioned at the beginning that the first time I was working with the program, there was 13 students in the program, and they were all fantastic, but they also had opportunities to kind of connect with physicians. And so what we wanted to do was make sure that we were reaching students who may not have had those opportunities, and still everyone. So we open up an application every year and have the students apply for a program called Top Health Summer Academy. That's its current name. It's, obviously taken some different ideations over the years. But Tap Health Summer Academy runs for a few weeks in the summer, and students get to go to a different healthcare organization every day. And that's one of the ways we work with the businesses. We don't just go to one hospital and show them what one place has to offer. We go to every different system within our region, and we go to health departments, and we go to, different places to show them different types of healthcare practice settings, so that if they don't maybe connect with one place, they can connect with another and not feel like, okay, well, healthcare is out. I didn't like that one spot. Like, we want them to get to see it all. And so we also wanted to make sure that we reach students from different schools and different types of schools. So not just maybe the wealthiest schools in the region. We want to get all the public schools. We want to get the parochial schools, students who are going through virtual school or homeschooling, and every type of school setting. The technical schools obviously are really important to us, and making sure that we let all the students have the opportunity to apply to these programs, and help them with transportation needs when we can, and help them with getting to different places, like making them feel comfortable while they're there. We get the students lab coats that they wear to the different events and things like that, so they can all feel kind of like uniform and accepted, and get to connect with other students who are also interested in healthcare. So that's one of the ways that we've brought access and equity together, just making sure the students that we go to events where the students have access no matter what their situation is. If they, have to have a boot on their foot or they're in a wheelchair, they can still get around and get to the different events. We want all of our students to feel welcome and accepted. So.
Okay. And I'm sorry, I had a problem with my mute button before, but because we work primarily with the underserved communities and also reentry, it's important for us to initially embrace these individuals, build relationships with them, help them overcome barriers, and then also help them with their mindset. So we do that with the job readiness program. So they'll come in, and it's about a week-long program. Once we actually go out into the streets and recruit people. So we can be in neighborhoods, we can be at convenience stores, we can be, just about anywhere where people wouldn't ordinarily think to recruit for employees. But the thing that we do is, once we build a relationship with those individuals and let them know that they do matter and that you can secure a job with a livable wage, just let us give you a little bit of training. So in the past, perhaps with some of those employers that they thought, I can never get in there, perhaps it was because they didn't have proper resumes. And we all know HR will spit a resume out if it doesn't look, acceptable. So we help them create an acceptable resume. Then we also discuss the environment of manufacturing. A lot of people, particularly from the underserved communities, they're just not accustomed to certain guidelines and living, I'd like to say, in an actual, not strict, but something that is in order. And there's an actual process that you have to go through. So it's been a little challenging with that because, like I say, we have to talk about attendance. We have to talk about being reliable. A lot of times the barriers are transportation, which is a huge barrier. So, okay, once we get you these jobs, how are you going to get to work? So there's a lot that has to be peeled away to actually get these people into these sustainable positions. But I think building a relationship with the individuals is actually secondary to building a relationship with the employers. So I think it's a real advantage with the ISP for the Stark County Manufacturing Workforce Development Program, is because we actually have meetings once a month over at the chamber, so we can actually find out exactly what employers are looking for in an employee, and then we can coach to that end. We can also speak with the employers to say, hey, you're probably going to be getting some people who may have some mental, not mentally ill, but just how life has treated them. So they may come with some baggage. And we say, just be patient with us and then consider the fact that this employment could change the whole trajectory of their lives. So if you're just patient with them, and if you work with us, we can coach them, to a better position in life. So that's primarily what we try to do with participants that we deal with, particularly from the grassroots. From an education standpoint as well, we offer the 22 plus. So if they don't come with a diploma or a degree, which is required a lot of times for employment, we have a 22 plus program where we actually help people get their diplomas. It's not a GED. They actually get their diplomas. And I'm proud to say that we had 103 graduates last year through the 22 plus program. And what a lot of the graduates, they wanted to have their diploma so that they can go into the healthcare, because we had a lot of STNA people and CNA that were wanting to continue their education to become nurses, but they couldn't do that without their diploma. So, like I said, with grassroots, we're out in the community. We're not waiting for anyone to come to us. We're actually going out there and pulling them in. And then when we build the relationships, they trust us and we build their confidence and we tell them, you can absolutely do this and we'll show you how. So we've been, successful in that. I had a very successful week just last week, because the new relationships that we build with the employers, they're happy when we call on them. They're like, okay, they're coming from this program. We have an idea that they're ready. So that's basically the importance of equity with working with ISPs. And then also, since fortunately, you have the preconceived notions about manufacturing, fortunately, most of our employers are what they refer to as clean manufacturing. So people are happy to hear about that, because you have this preconceived notion that you're going to go in and, in white clothes and come out in black clothes. But it's just not that. They're excited that they can go in. And I was at a job fair this weekend, and one of the participants came out and he was like, man, you can eat off the floors in there. So that definitely helps in encouraging people to go into the manufacturing sector.
And if I could just add to Frida's a little bit and kind of tie in with, there was a question in the chat from Caroline, I think, just about like those relationships with the manufacturers. Obviously, our ISP was kind of born from like employer-driven desires. And so we had, I would say, like 3 to 5 really champion executives at manufacturers that helped propel the ISP forward. But I also can see how other ISPs might struggle, like Caroline kind of mentioned, because it's difficult for people working in a business to find the time and like dedicate the energy to really like getting an ISP off the ground and then sustaining it. And so a lot of what has helped has been pulling in these external agencies like community-based organizations locally and education partners that kind of have staff dedicated more toward this sort of programming and these sorts of like meetings and activities and workforce development like ideas. And so they can help sort of bridge the gap between private industry and like the local opportunities, but they can also sort of serve as like liaisons for people from whatever industry it might be to kind of navigate the semi-nonprofit world and like this social service kind of programming that a lot of ISPs end up developing, or these educational programs that like we've heard from Hope and Helena, and that we kind of try to, rather than develop ourselves, like redirect toward. So, and Frida obviously touched upon that, and I'm sure Helena and Hope could as well. But I think that's like a big takeaway from ours is just that like we were open to other agencies, not just like our founding. And that also ties into establishing a sense of trustworthiness within the community. Like we're not here to try to steal opportunities or steal ideas or create new programs that already exist. It's like we're here to collect the group and then connect to the services that exist or to help develop those that are necessary. And then I think there's some other questions, so I'll stop talking.
No, that's great. I am so glad you picked up on, there was a question in the chat about what happens when business partners have to take the lead. So one of the things that when I am coaching someone on a sector partnership, and this, I think it reflects a lot of what Alexander just said, is that the industry or business leadership is about them setting the agenda. The business is coming together and saying, here are our labor shortages, here are the things that we need, here are the problems that we're trying to solve, and then bringing in the right partners to get that done. So often you need an intermediary, a convener, a person who can come in and help to navigate all of that. So the businesses are still leading and that they're setting the agenda, they're identifying the priorities, but someone whose job it is to solve these problems is then pulling the right levers to meet those needs. So I think that's something, and it is, you mentioned, Caroline, next gen sector partnerships in your question. I think that's different than the way that this group thinks about sector partnerships, and that each of the sector partnerships here on the panel today have a neutral intermediary doing some of the work, and they don't get completely out of the way like the next gen model recommends. I saw Hope, you came off mute. Did you want to jump in on that?
Sure, and I definitely ditto what you just said. I was going to add to your comments that the Health Collaborative is a membership organization for our health systems in the greater Cincinnati region. And as such, doing workforce in this, our concern is that we add value to our membership. And I like to describe our work as us being in the rooms and the spaces where our employers are not. We're an extension of their workforce, meeting their needs. And I mentioned in my intro that my work in community college and the different experiences all has helped me in this work, because the employers need employees. They don't necessarily need to know how the sausage gets made. They need employees, and they need to be able to do their job, and we all need them to do their job. I've got all the time in the world to meet with my employers, with my educators, and see how I can help them to expand their talent pipelines. And that's the space I play. And so we're the convener. We bring people together every day. And, some days there's some amazing things that happen. Other days it's just, an inch closer, hopefully not a foot backwards. And so we're not looking to turn this work over. I will say, though, in most areas, it doesn't seem like a lot of people are competing to represent healthcare. Even our big chambers are not competition. They love that we're in this space because it's so unique. And I do see in manufacturing and IT and even supply chain, sometimes that's a more competitive space. So I may be very spoiled doing the work that I do, but it really is about being employer-led, going out, vetting solutions, bringing them back, thumbs up, thumbs down, and not getting upset if they don't like them. I mean, there's some things I've brought back that I feel like I'm pounding my head against the wall, trying to get them to adopt. But if they're not ready for them, I have to meet them where they are. And I think that's a big part of, even, I know we're going to talk about some of our final words of wisdom. Mine is partners of the willing. When these relationships all seem to have very different seasons, depending on some of the comings and goings of key staff. And it's been a very volatile workforce for every industry. Turnover is incredible. So finding those champions and those partners of the willing to really go the distance is just imperative to moving the needle, at least in my experience.
Mhm. Yeah, I wholeheartally agree. And I think we just got a question in the Q&A that speaks to that, Hope. So I will, I'm going to jump to this question and then go back to the scripted questions we had. So the question is, are there any efforts towards working with industry/employers on the well-being of their employees, or any retention strategies in place? And I know that both of you are doing that, so we'd love to hear it. Go ahead, Hope.
I'll just jump in. We were very grateful last year to get a sizable investment in our industry sector partnership grant that allowed us to provide resiliency training to healthcare workers for free. And we had hoped we'd be able to track down more of the workforce that had walked away from these jobs, that they had 2- and 4-year degrees or more. But the pandemic changed that environment more so than most. And we did have a few that were on a hiatus from work that hopefully we helped to return to, not as many as we wanted. But being able to provide that toolkit to these workers, the survey results were incredible. And the thankfulness, and the one person had already turned her resignation in and came to the workshop and went back and talked to her manager to rescind the resignation. And they were thrilled to have her stay. So that was one thing we were able to do. And, you know, the catch-22 is we're kind of saying you're not strong enough, but that's not what we're saying. We're saying reality is reality, but at least here's something that might help. And so we never would want our nurses or any other of the healthcare workforce to think it's not that the problem's them. It's just, can we help you in the current scenario? Being this understaffed leads to a whole array of challenges, and we just want to make them able to put it into a way that they can control their own reactions to their environment.
Yeah, that's great. What a great success story. Alexandra, go ahead.
Yeah, so obviously the dynamic in manufacturing is not nearly as emotionally tolling as we've seen like healthcare lately in the past 5 years, given the circumstances of our world. But we, as an ISP, received part of a grant through the Ohio Manufacturing Association, and it's like an ARPA grant through the EDA. And part of it is for like upskilling existing employees at manufacturers that are like our partners. And I won't deny that I have had a harder time getting manufacturers to kind of bite onto like really investing in their existing workforce, and not just in like their trainable skills, but also in their soft skills training. But some we have seen are really interested and like active on doing leadership development training and kind of like those social skills and wraparound service training that for existing staff that will help with retention of their employees and will help attract new, because like the floor managers and like the plant managers and the upper level staff do have like the necessary skills and understanding, and then like trained behaviors and actions that make people want to continue working there, that make it an equitable, a fair, pleasant environment for new and existing workers. And that's definitely been a focus generally of manufacturers, because at least locally, they've recognized like we have to be a good place to work. So at first, a lot of the focus is just like, how can we like have a better on-site clinic, or how can we provide better benefits or incentivize people to like come 5 days a week, or give them a bonus for like having good attendance for the month. But now they are starting to see like, maybe we need to work on soft skills development of our existing workforce to ensure that's not part of our problem as well. So it exists, and we have grant dollars to kind of support it. It's a matter of like manufacturers wrapping their heads around best practices, best ways to like implement that without affecting production and the usual concerns of businesses, but we're getting there.
Yeah, and I'd like to add on to Alexandra, that is absolutely an issue with retention. So I have actually spoken with HR managers who they'll come out and tell you that, sometimes it's not the employee, sometimes it's the manager. Sometimes poor management causes people to walk away from their jobs. So we've had that discussion. We've even offered, how about a job readiness for the managers? We can teach that, but definitely it is a problem with retention, and I think that's why we have in our particular program we have what I refer to as repeat offenders. So we'll get you a job somewhere, but then they'll leave that job and they'll come right back to us and say, hey, Frida, is there anywhere else you can send me? Because, because of the lack of good management at the positions or at companies that they've gone to. So that is a major issue.
Yeah, it's a tough one. We're seeing a lot of turnover, particularly, I mean, probably every industry, but I've seen it a lot in manufacturing. So that goes to, Frida, there was a question for you in the chat. What's your success rate once you get someone into the program, with success being defined as holding their job for some amount of time?
Okay, so we've had a pretty good retention rate. I would say probably somewhere in the neighborhood between maybe 65 to 68%. We would definitely like to see that increase. But I think the way that we're able to get that rate is because we actually coach to the people. We have an engagement coach. So we have someone who follows up with them. There's a 30, 60, 90-day follow-up. They're stretching it out now to a full 6 months. And then we also have during we call it boot camp because we're definitely working you out. We're working you out mentally. We're working you out. We're going to talk about how to manage your finances. We're going to talk about time management. We're going to talk about PTSD. We're doing the whole gamut in what we refer to as boot camp. So during that period, we coach to, okay, how important is it for you to maintain your a salary, an income? What is your why? What makes you get up in the morning and head out to work each day, or what makes you get up? And a lot of people say it's because I have to take care of my family. So we coach to the fact that, if you lose your employment, how are you going to take care of your family? So we coach to don't let anyone or anything or any circumstance or any situation cause you to lose money from your family's table. So we coach them, let them know that there are alternative avenues that they can take. Read the employee handbook. What does it say if you're experiencing a situation, maybe, controversial, or someone is picking on you or bullying or whatever? What does the handbook say? Utilize that to your advantage. So we absolutely coach to, okay, keeping that job. If you don't really want to work in a manufacturing position, what is your goal? What is your dream? What are you trying to do? Can you utilize the income from this company to leverage whatever you're trying to do? If you want to move into entrepreneurship, then can this job help you get there? So we turn over all the leaves. We definitely find out what is it that you want in life. Let us help you get there.
I love that. Well, time is flying. We just have about 5 minutes left. So I will plug for audience questions. Sorry, I lost my train of thought there for a second. Audience questions one last time. If you have something you want one of our panelists or all of our panelists to answer, please drop it in the chat or in the Q&A. And while we are waiting for any of those last things to trickle in, I'm going to do a round robin. And Helena, I'm going to start with you with what words of wisdom would you offer to our audience, to someone looking to get a sector partnership started?
Sure. So I know everyone always thinks their job is the backbone of everything. So I don't mean to sound like that, but I really do think that the backbone of everything is career exploration. So for all of you who, I don't know all the different industries who are represented on the call, but I will tell you that I'm in meetings monthly with people in technology, engineering, manufacturing, construction, just a number of different careers that have their own ISPs and work together really well because through the avenue of career exploration. It's a great way to get your industries involved. I think it was Carolyn who had a question earlier about how to get the businesses to take ownership of the work. And I found that a lot of businesses like career exploration. It's a great story. It looks good for them. It's easy to sell to them, to the media, to write photos for social media, to maybe get the news to come out, to get a blurb for newsletters and things like that. So it looks good. It also is a great way for organizations to focus on their retention. I know we've talked about that a lot today. I go to events where the people who put the events on say directly that, oh, these nurses that came to these events or these respiratory therapists told us that they like their job better every day that they work with your students and that they look forward to this event every year. So we literally, by taking these high school kids into the hospitals and taking them into different organizations, we're getting people to like their own jobs better, because when people start talking about their jobs, whether it's in healthcare or whatever the field is, they love them more. They want to talk about the reasons why kids should go into their field. They get excited. They're also always looking for new things to share with them, like, oh, this is a cool thing that we learn, that we do in this industry. And so it's a great way to retain employees. It's a great way to engage employees. And it's also a great way to get your employees involved who might not have a big role. Maybe they can be on a young professional board and work with career exploration, or a different type of advisory board. And then also the teachers in the schools, I know that it's a whole different industry and you're like, well, we don't want to tackle another one. But when you think about it, when you go to these schools, you can get a lot of teachers who are, the backbone of the whole country, who will work together to kind of help you with this work. So if you get these high school teachers, they're going to be caring about their students who are interested in construction, healthcare, whatever the field, all at once. They want to know all the opportunities in every industry, at every organization. So you can get them to do a lot of work for you as well. So if you're having problems getting these organizations involved, that's just one way I recommend, is to beef up your career exploration efforts. We've been doing it for a while. We're always constantly growing. It's not just being flexible, but it's being adaptable. And I could share tons of examples, but really I just want to make sure that you at least have that as part of your ISPs, because it is a great way to just grow them organically. It's low cost and it's really easy to get people involved. And then hopefully you can move them into other roles within the ISP, even beyond the career exploration space. So that's my advice.
Thank you so much. I love that. It's really practical and actionable. Thank you. I'm going to go up to Alexandra next.
I'll be short, but I think the biggest word of wisdom as you're considering developing an ISP or building out yours or whatever it might be is that obviously for the engaged partners for whatever industry you're talking about, you're selling it as a benefit to them, but the reality, and for me, the root of all of this is a means of uplifting your community by servicing the people in it. So combating these workforce issues, that's tied to a person, and the goal should always be something that people will appreciate, will want to utilize, and that will make their lives better. Even in a minor way, if it's uplifting wages, if it's making their work environment slightly less toxic or a bit more equitable, even in minor steps, that should be your driving force. And the good companies will get involved. And those are the people that you should, like, based on principle, want involved. And they filter themselves out. And then you end up with great programs. So that's my thing.
I love that. Thank you. I'll go with Frida next.
So I would say, when dealing with the partners, I think it's a good idea to have a strong relationship with them. So I have several of my employer partners. I can call them and they'll answer, or they'll call me if there's something going on, to let me know we've got a little situation. You may want to have a talk with this person before they lose their job. So that happens often. I'll get calls, and we have employers who will send me an email immediately after I've referred someone over to say, thank you for that referral. He's going to be a good fit. So I think the best that we can do is to have strong relationships, not only with the employer partners, but also with the participants, and letting them know and letting them see that we're sending you good candidates. So as soon as I get an email to say, hey, you sent over Mr. So-and-so today, and we're going to hire him, I immediately send them a letter thanking them for helping us to help them and for helping their community. So, that lets them know that, okay, we're special, we're doing our job to help benefit the community, and it makes them feel like, they're giving back as well. So it's just, I say relationship is the key component to pretty much everything and building good relationships.
Yep, absolutely agree. And Hope, you'll get the last word.
I already sort of shared my insights here, so I'm going to go backwards to more of the equity question, if that's okay, but I will be brief. Because one of the things that I'm so excited that we have done in the last few months is build a regional healthcare workforce data dashboard with an equity lens. Because if you don't know where you are, you can't possibly know if you're getting in the right direction. And we've had data that we've had access to, but when we finally now have the ability to share this data broadly. And Sarah is putting the link to this data dashboard in the chat for me. The beauty of this is it not only shows the size of the market and all of those kind of stats I shared with you at the beginning, but it helps us to tell our story and to give a very comprehensive view to the makeup of our current and our incoming workforce, the individuals that are earning the different credentials that we need for our top 10 in-demand position. We can see demographics, race, ethnicity. We can see age of workforce. We can see where people are coming from. Just so much insights. And it's our hope that by us making this information readily accessible to all of our partners, to anybody who wants it, that we're helping them to make the right strategic priorities in building workforce so that educators can look at it and know what's needed. More than that, it also helps them to have the data they need to request investment or to use when they're doing their grant applications. So I think the more able you can tell the story with data, it's helpful to your overarching ability to get to your goals. I hope that's helpful.
Yeah, I think very, very helpful. Data is, you're going to need it when you talk to manufacturers or businesses. Sorry, I'm still getting out of the habit of talking about manufacturers primarily. When you're talking to businesses, they're going to want to know what's the ROI for them, what's the value. When you're talking to funders, you're going to need data. So yes, absolutely critical. I know we are over on time, so I want to thank our panelists for being with us today and sharing your expertise. I want to thank all of you for being here and being patient with us as we work through our technical difficulties. Remind you that you'll be getting a follow-up email with a survey. We'd love to hear what you think. And I think that's all for today. So you get to enjoy the weather. It's really warm and lovely in most parts of the country today, I think. So have a great afternoon, and we'll see you next time.
Thank you.
Thank you.
Bye, everyone.